I said you were going to be here, everyone's eyes got excited, and I think they automatically went for their questions, so I think you're going to get a lot of questions. So Dr. Rosario, come on up, have a seat. And and here's Debbie Silverman with the Department of Nutrition Services. She is our integrative medicine and functional medicine nutritionist. And then we have Kristin Lothman, who is our mind-body expert, as well as in the Department of Social Work. I am going to grab the questions. Do we need the microphone? We do need. So I was just told that I didn't introduce myself. I am so embarrassed. So I guess I didn't introduce myself because so often it's like kind of already, and I know a lot of you, but my name is Dawn Mussallem. I am a diagnostic breast specialist in the Jacobi Center for Breast Health. And in the Jacobi Center for Breast Health, my role is kind of multifaceted. So the first thing that I focus on is breast cancer prevention. So I deal with our high-risk population. I deal with all our newly diagnosed cancer patients, and then to make it full circle, I receive them back in the survivorship clinic. And I also work with the Integrated Medicine and Health Program. My special interest, as you can guess from what we just talked about, is lifestyle medicine, prevention, and especially survivorship care and living fully. So we are going to go ahead, and I have to be good with this. I did this one time by myself, and I said I'd never do it by myself again. I wanted to have a panel, so thank you, panel members, for being here. And I think what we should do to get started is, since Kristin is with us, Kristin, do you mind taking us through a guided meditation?
I would love to.
Let's do that.
Yeah,
that'll be good.
So I think this will be a good time to check in with our own bodies and our own hearts. So I invite you just to sit up a little taller and maybe uncross the legs, feet flat on the ground. And maybe lower the gaze, maybe 4 to 6 feet out in front of you. And if you feel comfortable to, I invite you to close the eyes. Just for a few moments here, we're going to turn our attention inward, paying attention to what it feels like to be in our own skin. Maybe noticing the shape of your own body. Maybe even feeling the own weight of your body as it rests into the support of the chair beneath you. Making tabs of any sensation that you might feel arising in the body. Tingling, movement, aching. Maybe there's a lack of sensation, and that's okay too. By now, the mind has likely wandered off into thought just for a moment, and that's okay. And I just invite you to simply inhale your awareness back into the body. And if you'd like, just settle your awareness into the breath. Noticing what it feels like to inhale, and noticing what it feels like to surrender into an exhale. Spending a few more moments just enjoying the simplicity of breath, enjoying the experience of not having to really do anything right now. And on your next inhale, I just invite you to breathe all that valuable information that Dr. Mussallem provided. And on your next exhale, just let it settle into the heart. And from the heart, maybe just ask, is there anything else I would need to know that's in service to my well-being and in service to the well-being of those around me? One more inhale. This time just make it nice and deep. Hold. And then exhale, letting it go. And when you're ready, slowly open the eyes.
Thank you, Kristin. We're going to be so excited to have you here. Kristin is new to Mayo Clinic, Florida, Jacksonville, and Kristin, is, you understand now, is our mind-body expert. I'll reintroduce the panel since everyone is seated, and I know for our Facebook Live members, it was a little bit hard to know who I was introducing. Debra Silverman is our integrative nutritionist as well as functional medicine nutritionist. She wears a lot of hats at Mayo Clinic, both inpatient and outpatient nutritional services, as well as our solid organ transplant population, and she has been pivotal with the advancement of nutritional therapies here at Mayo Clinic. And Dr. Rosario is one of our exercise experts, and his special interest is in the area of cancer rehabilitation, both during the cancer treatment journey as well as after. So it's really exciting at Mayo Clinic to have experts in these areas of medicine that can really help guide patients as to what they need to do and to do it right. So thank you all for being here. So we have a lot of questions. So the first one, Debbie, is for you. And people want to know, coffee, is it good? Is it okay?
Actually, yes, coffee is beneficial. So let me give you a comprehensive answer on that because a lot of people have questions about coffee. So a lot of epidemiological studies and experimental research suggests that coffee consumption may help prevent a lot of chronic diseases. A lot of the research has been done in type 2 diabetes and liver disease. So also very interesting because there's always been a conception that coffee plays a part in cardiovascular disease. And as it turns out, likely that does not increase cardiovascular disease risk. Also, there's evidence that decaf coffee is helpful as well. So because, remember, coffee is a plant substance, it's a bean. Likely there may be other, they call them polyphenols, that are the healthy ingredients in plants. Likely one of those may actually be the instigator for good health. We just haven't identified it yet. So for adults consuming what we call a moderate amount of coffee, 3 to 4 cups of coffee a day, which would provide about 300 to 400 milligrams of caffeine, there's no evidence of health risk and evidence of some benefit. Now, I will add one thing. Be careful when you're over at Starbucks. Getting one of those nice frappuccinos that you always get a coupon for. I know I get that, where you can invite a friend. Maybe not such a good idea to do that because a cup of black coffee has only 2 calories. So we're basically talking about something we wouldn't even pay attention to. But one of those frappuccinos, a mocha frappuccino, has at least 400 calories.
Yeah, so I think what matters is, what do you put in that coffee?
Yes, it does. Yes.
Is it just your plain cup of Joe, or is it a little more? That can be a problem. And those drinks are expensive, too. So here's a question actually for me. They would like me to comment from one of our Facebook Live members on the anti-estrogen therapy for breast cancer, side effects and quality of life. That's a big question, right? And it's complicated because, sure, I talk about everything I just talked about like it's simple, easy breezy, but the facts are is it's kind of hard to get motivated when you really feel pretty poorly. The exciting thing is that we see both with tamoxifen and aromatase inhibitors that we can really mitigate those side effects of treatment when women exercise. So I really want to drive home the importance of that, and in particular with women on aromatase inhibitors with their joint pains, because that is the one side effect that women come in with that bothers them the most. Now, interestingly enough, out of all the patients we see in our practice, those patients who I follow have the least side effects. I think that says something. I think it says something not because of the physician I am. It says something because I really push hard on my patients about the importance of trying to eat as healthy as they can, about exercising, and also we navigate through what they're experiencing from a pain standpoint. So I'll be honest, we don't always succeed. The diet, the exercise, I mean, I have some women that are doing it perfect, and they're still miserable with these joint pains. So what do we do then? I think that's how we really need to answer this question. We're looking at the American Society of Clinical Oncology guidelines. We see that acupuncture is a therapy that can be considered for pain. We know that there is evolving research. It's very difficult to do acupuncture studies in part because of cost, but it's hard to get large enough acupuncture studies out there that would increase this grade of evidence so that there were acceptance by insurance companies to pay for the acupuncture. So I do encourage acupuncture if women continue to have these joint-related pains. There are some pharmacologic medications you can talk to and consider as well if they're having joint pain, things like Cymbalta. That would be something you would want to talk to your medical doctor about if you're eligible for that. So other side effects of anti-estrogen therapy would be hot flashes. Gosh, what do you do with hot flashes? I mean, there are a lot of things you can do naturally. We know that weight loss actually helps to reduce hot flashes. Kind of doesn't make sense scientifically because we know fat harbors estrogen. So you would think if you have more fat, the hot flashes should be better. But the science doesn't point to that. And instead, the science actually shows that when you lose weight, the hot flashes get better. And so what they found in research is that actually is a motivating factor for women to lose weight, that when they lose weight, their hot flashes get better. So that's exciting. There's things like cognitive behavioral therapy, hypnosis, relaxation therapies that have also been shown to be possibly beneficial. Then we look at the medications. So there's certainly medications that we can talk about to help hot flashes. Some of the selective serotonin reuptake inhibitors, medications like paroxetine can be beneficial. There's a selective norepinephrine reuptake inhibitor, so medications like venlafaxine can be beneficial for hot flashes, but both of those medications can have side effects. So sometimes you replace one problem for another problem. That's why I am doing the magnesium glycinate hot flash study, because I was seeing in a lot of my patients that they were taking this very simple mineral that was helping them with their hot flashes. And so we're doing a study now to try to validate if in fact that's a real effect or was it more of just a placebo effect. So I don't have the data from that study yet to be able to make a large comment. We can go to other medications that have newly been investigated. A study at Mayo Clinic, Rochester by Dr. Loprinzi looked at oxybutynin, which is a medication we use for urinary incontinence. I think that's one of my favorite ones now for hot flashes. I don't see that my patients have side effects from it. It can cause dry mouth, but women do really good on that medication. And then lastly, I'm going to go back to the acupuncture again. Again, not enough studies to validate it, but acupuncture can't hurt you, and I have seen it be very beneficial. So I think there are things we can do from the most common aspects of the anti-estrogen therapy I see that reduce quality of life, that being joint pains and hot flashes, that can help women during the duration of these anti-estrogen therapy medications. But again, going back to what I see in my own clinical practice, my patients who are more optimized usually, now I have had outliers, but my patients who are more optimized from a wellness perspective, both mind, body, and spirit, seem to be those that can navigate through these symptoms best. So I hope that answers the question. Okay. So the next question is an exercise one. How many steps on my pedometer is enough that can fill my exercise requirement?
So currently, there's not a specific kind of amount of steps that we know that we need to start walking or running. to get a beneficial effects. When we're talking about benefits of exercise in cancer patients, we're more talking about minutes. So currently, the recommendations are 150 minutes per week of moderate intensity exercises or 75 minutes per week of high intensity exercise. So an important point of that aspect is that if you're not used to doing exercise, don't start doing 150 minutes per week because you're not ready to achieve those recommendations. So my recommendation would be to start slow and progress slowly. So usually I recommend 20 minutes 3 times a week and start with that, and every few weeks try to increase that distance, try to increase that time until we get that 150 minutes at least. If we get a little bit more, even better. But in terms of steps, that's something that we need to figure out if we get like a amount of steps to try to tell the patient that you need to achieve with it, because it's easier to count them and they can follow it more easily.
Yeah, I agree. I know, I usually try to get my patients to take about 10,000 steps a day. There's some recommendations that have pointed to 7,000, but I completely agree. We don't know yet. There is a Fitbit study in breast cancer patients, and that data should be available hopefully soon, so it'll be kind of interesting to know. But again, that data is going to have to be followed longitudinally. It's going to have to be followed for 5 years, 10 years to really see that long-term benefit. So,
and the other important factor would be that you don't need to, so you can divide the 150 minutes throughout the week. You can do it 3 times a week. You can do it by walking every day to a less amount of time. So it's just the accumulation of physical activity, which is the important factor that you need to start doing, because the benefits are extremely high.
I agree. So I have a mind-body question. How do I practice mindfulness, and where do I begin?
Okay, that's a really good question. Again, mindfulness, there's a lot of research now that it has benefits into helping with anxiety, helping with depression, or it's a non-pharmacological interventions for those kind of things. And mindfulness is really about paying attention on purpose, right? And paying attention in a way that where there's no judgment of thought, right? So the concept of mindfulness is pretty simple, and what I have discovered in my own journey, right, in the process, is that it's not easy, right? My offering to kind of where to begin is kind of start where you are. A lot of Amit Sood's stuff is really geared towards kind of changing the tenor of your attention, so that, again, like a joyful attention. There's also, which would be a more kind of informal way to practice. There's also informal or formal ways to practice, right, which is sitting intentionally for a period of time where you can practice paying attention on purpose, right? The formal practice, oftentimes I will sit with people, I will instruct people on how to cultivate a formal practice. And then also we'll discuss what pops up, right? Because what you know, and oftentimes, is non-judgmental awareness is something that takes quite a bit of work. And I actually, a lot of women have to befriend the inner critic that arises. So again, where to start is start where you are, right? If you have a informal practice, a formal practice, you're already sitting with like a mindfulness app, right? Insight Timer is one of my personal favorites. UCLA also has a mindfulness app that, is a really great starter app that I really, really enjoy. Those are really great places to kind of start a formal practice. I suggest maybe starting with 1 to 3 minutes. And as you kind of build that stamina, you can lengthen that time for a little bit longer. If you're needing additional support, again, sometimes when we sit and we're still, a lot of things come up to the surface, right? That inner critic, anxiety, the sensation of anxiety, depression, the sensation of depression, grief, loss. A lot of emotions can kind of arise, and as we kind of become more attuned and sensitive, sometimes they can be a little bit overwhelming to manage, right? So that's how here I offer support, yeah, that's about it. I apologize. I hope I answered the question.
That's a great, that was a great answer, and I think what you had said there kind of triggered my thought is, it's exercise for the mind and soul is really what mindfulness is about. Yes. And I think we need to prioritize it and really encourage our patients to take part in it just as much as we do true exercise. Pure exercise. And I think for a lot of patients too, I get the question like, well, what about prayer? And I think that's very comfortable for a lot of patients is prayer, and it's very familiar to them, maybe their upbringing. So that can also be included in some of those reflections.
Absolutely, and I think that's a really good point because, again, prayer is also a concentration practice, right, as well. And what we have noticed is that a mind that's going all over the place, right, that is what causes disconnection from our bodies and what causes us to feel disconnected from life. And so prayer is a beautiful example of how can I just kind of attune my attention to one place that's meaningful to come back into connection.
That's a great answer. I have a question from a young survivor who is mentioning that into her survivorship years now she would like to become pregnant. This is a little bit of a difficult question for me to answer because I don't have specifics. I don't know if she has estrogen receptor positive cancer, estrogen receptor negative cancer, or how many years out from her diagnosis she is. So my recommendation for the listener is going to be a very general one, and I apologize for that. But what I would recommend is that you first have this conversation with your medical oncologist, because there are different thoughts depending on the type of cancer you had and the stage of your cancer, as well as that you are probably already, being a young cancer survivor, working with a fertility specialist. And I think both the fertility specialist and your medical oncologist can collaborate and give you the most accurate answer, the safest answer for you. There is some research being done to look at women with hormone receptor positive breast cancers that need to be on anti-estrogen therapy, and can you pause that therapy around 2 to 3 years, allow the woman to get pregnant in that window of time. So that may be a question you'd like to ask your medical oncologist is, you've heard there's some research investigating this, what are their thoughts, and allow your medical doctor to individualize your treatment recommendations for you. Okay, that was from one of our Facebook Live viewers. So the next question is a nutrition question. It says, what is one serving of vegetables or fruits, and how many servings should I get?
Okay, thank you. So there is a lot of confusion I find out there about exactly what eating a lot of fruits and vegetables mean. So typically we like people to get anywhere from 5 to 11 servings a day. So a serving would be a cup of vegetables, for example. So I can actually tell you more definitely what that means because I wrote that down. So actually very interesting, when I was researching this question earlier to make sure I could give you a comprehensive answer. So according to Centers for Disease Control, only 1 out of 10 adults get enough fruits and vegetables every day. So we recommend eating a minimum of 5 and hopefully up to 11 servings a day. And that would be at least 4 to 5 minimum servings of vegetables and 2 of fruits. So a serving would be a cup, as I said earlier. So most vegetables, 1 cup is equal to what would fill a 1 cup measuring cup. But 1 serving of raw leafy greens like spinach or lettuce would be 2 cups. And 8 ounces of, now we don't recommend fruit juice at all, but some vegetable juices or tomato juice are okay. And you would want to do like a 4-ounce serving of that. So a 1-ounce equivalent of vegetables would be, for example, 2 medium carrots. If you cut that up, put it in a cup, 5 or 6 broccoli florets, a large sweet pepper, 1 large sweet potato, an ear of corn, a medium white potato, and a large tomato. Does that make sense to everybody? So it's actually fairly easy to get them. If you think, one of the ways that I use to explain that to people is if you took like a 10-inch dinner plate and you divided it into halves. So 1/2 of your plate should be vegetables, or actually 2/3 of that half should be vegetables, and the other third should be fruit. And then you would have also some whole grains there, and then a small portion of protein.
Okay, thank you. Yeah, there was a recent study that had looked at cancer survivors and how much vegetables and fruits they get, and over 48% had less than 4 servings a day. So that was all cancer survivors. It wasn't breast cancer specific, so I think that's interesting. And I had once read a really quick take-home. They just said about the size of a baseball is like an estimate of about a serving of vegetable or fruit. So that's kind of like something you can eyeball. And you know, it's been interesting because a lot of cancer survivors stay away from fruit because they're really scared with the sugar. And in fact, there's a lot of research that shows that fruit carries a really robust benefit, especially in the prevention trials. So I encourage you to do both the whole vegetable or the whole fruit, staying away from the juices of the purees. It's always better to have the whole product with the skin. One thing I was going to say, I think it's always interesting what vegetables and fruits are better raw versus cooked. And the one vegetable that may be, well, 2 actually, that may be a little better cooked would be carrots and tomatoes.
Right.
You know, so we think about carrots and some people are like, oh, but when I eat them, my digestion, well, it's okay, you can steam them, so that would be just fine. But I think that's a great question, is that quantity. How do you get to that goal? Because it's something we really drove home today.
One other thing about that, if I could. So.
Yeah.
There's been many epidemiological studies going on. One, the Nurses' Health Study, and also there's been, I believe it was Women's Health Study. So these studies have shown repeatedly that the people that eat the most fruits and vegetables are the ones that have the less reoccurrence of breast cancer.
Absolutely, and American Institute for Cancer Research is really showing that as well. I think that we know this, and we know we can't put it in a pill. Okay, great. One exercise question here. If I walk for 5 minutes at a time, does that count towards my exercise goal?
Yeah, definitely. So one trick that I tell my patients is that try to park far away. So you can have that steps and that exercise. Try to use more the stairs. So all the activity that you do during your day, that counts as physical activity. So walking 5 minutes in the morning, then at lunch, 5 minutes at night, all that counts in terms of the total exercise and benefits of increasing your physical activity, because you're increasing your metabolism. So all the benefits are going to be present. So every little or big amount of exercise that you can get is beneficial.
Great, thank you. Okay, we have a Facebook Live viewer question. And this is a 57-year-old female with the BRCA, a BRCA gene 2 mutation. She decided she has not had breast cancer, and she chose not to have a prophylactic mastectomy, but she did have a total hysterectomy in 2012. She is now on estrogen replacement therapy and doing well. She's followed with MRIs and mammograms alternating every 6 months. She wants to know my thoughts on this. So, you know, again, it's always hard because I don't have the information in front of me, but this is maybe a little different than what I would recommend to a high-risk patient coming in to see me. So I'll get a little bit, very briefly, into the BRCA1 versus BRCA2. And typically BRCA1 patients are patients with the hormone receptor negative breast cancers. So if I have a woman who's BRCA1, she's never had cancer, and she comes in, she sees me, she says, Dr. Mussallem, I do not want to have a prophylactic mastectomy. We continue the discussion. She says, but I am willing to have a hysterectomy and have my ovaries removed, because in BRCA patients, they're at risk for both breast cancer as well as ovarian cancer. So we have this very complicated discussion because these women have to have 2 surgeries. That can be really difficult for them to kind of process, right? And here's a woman that's never had cancer. But again, going back to the BRCA1, we know that if this woman got cancer, the most likely cancer she would get would be a triple negative, or it would be an estrogen receptor negative, progesterone receptor negative cancer, and maybe a HER2 positive cancer. So bottom line is BRCA1 cancers are hormone negative. In a woman like that had a prophylactic hysterectomy, and she was less than the age of 45, I would actually be okay with her using hormone replacement therapy. Because when women have prophylactic hysterectomies younger than the age of 45, her brain, heart, and bones need those hormones, right? And so then I would follow her with a high-risk MRI and mammogram alternating every 6 months. But again, knowing that that BRCA1 woman probably isn't going to get a hormone receptor positive cancer anyways, I would have some comfort allowing her to be on hormones. But we have a problem here because this viewer is saying that she has BRCA2. Now, BRCA2 typically presents with the estrogen receptor, progesterone receptor positive cancer. Okay? She had her hysterectomy when she was younger, so it was 5 years. Oh, I'm sorry, it's 2019. I'm kidding. The years have flown by, haven't they? So she had her hysterectomy at the age of 50. So I would not feel compelled to put a 50-year-old woman on hormones for a long period of time. What I would say is once she has that hysterectomy, if she felt really unwell, maybe a very short course of low-dose estradiol that's transdermal could be considered. But I myself would not feel comfortable in a BRCA2 woman who still retains her breast tissue and knowing that her breast cancer risk is upwards in the 70 to 76% range, though some numbers would show it to be maybe a little bit lower depending on that penetrance. Still, we know that risk is very, very high, and I feel that estradiol could perhaps provoke a cancer. And I don't think I would feel comfortable with that. I guess my question would be, why are you on the estradiol? What symptoms are you experiencing, especially at the age of 57? Off the estradiol, is it hot flashes that you're experiencing? Is it vaginal dryness you're experiencing? Is it mood disturbance you're experiencing? How serious are those symptoms? What other non-pharmacologic, specifically non-hormonal medications can I use to treat those symptoms? And generally, we're very, very successful getting women, especially after the age of mid-50s, off their hormones and onto something safer that would not provoke breast cancer. So that would be my recommendation. I guess the good news here is we know that the medical team is following her very closely with an MRI and mammogram every 6 months. So I hope that this patient never gets cancer, but if she were to get cancer, we would feel comfortable knowing they would find it at a very early stage and then they could intervene. But it still worries me quite a bit. So very good question. And maybe you would consider having a second opinion, meeting with another doctor to talk about optimization of the current care. Okay, oh yeah, I'm reading the questions. So, sorry about that. So the next question is, this person's mad at me. So they said, your supplements don't work, I get it, but what about putting those fruits and vegetables in a smoothie? So I think this is a great question. Debbie, I'll let you answer that one. Yeah.
So, actually, it would depend on what kind of smoothie it was. So the problem is when you start to puree fruits and vegetables, very often you lose many of the nutritional components that they contain, especially if they become, almost liquefied like a juice. And then you could be drinking things that are very high in sugar, which we know that sugar has a lot of inflammatory properties. So typically, my feeling about smoothies is if you are not having any problems eating and you don't need to add something in, like a protein smoothie, then I would recommend, and what we typically recommend, is that you just eat the fruit or vegetables. Now, vegetables sometimes could be a different story. And again, it depends on, what vegetables they are, what you're using to make the smoothie, what type of machine it is, because certain kind of machines actually don't pulverize it so much that you are basically getting rid of all of the nutrition. So that's all things we have to look at, but quite frankly, all the research indicates that you're much better off eating the real food versus making a smoothie.
Okay, great. So here's a mind-body question. Can you show me how to breathe properly? I like that question.
Okay. There's several breathing techniques. Oftentimes it just depends on what the person is breathing for. diaphragmatic breathing, or breathing having what we call in some terms Buddha belly, right? Breathing into filling up the belly with air is a good place to start. In a lot of practices, really focusing more on the exhalation, right? And then noticing the kind of how the body naturally responds to an inhale really is a good place to start. It has a really calming benefit as well. So I would encourage this diaphragmatic breathing into the belly. And perhaps if you want to even expand, you kind of notice that the rib cage will expand, and then the rib cage will contract, and then the belly will lower. So that would be a good place to start. That would be one type of intentional style of breath, but like I said, there are very many different types of breaths that you can do for different things.
Great answer, thank you. So for Dr. Rosario, can you exercise too much? And can you summarize the benefits and the importance of exercise in breast cancer survivors?
That's a great question, especially in athletes that are used to exercise. When they get a diagnosis of cancer, they try to do too much. And the basic answer will be that more exercise generally is better. Higher intensity is generally better, but you have to be careful to not go too fast and try to overdo and overtrain and maybe get injured trying to get more exercise and more miles in your training. So the answer is more is generally better, but you have to be careful on how you train. So basically, if you're not used to doing any type of exercise, start low and go slow and progress to the point that you're getting more and more exercise. But pace yourself. Every few weeks, try to increase. Do not go too fast because you can get injured, get stress fractures, get other musculoskeletal complaints. So you have to be careful. And the other part of the question is the benefits of exercise in cancer patients. So basically, we know that any type of physical activity can improve and help any cancer patient, and for that fact, everybody. We know that can treat chronic conditions like diabetes, hypertension, and now we're learning more that actually can help with cancer. So number one, the main benefit is that if your physical activity is high, your risk of having cancer is lower than another person that have a low physical activity. So before getting a cancer diagnosis, start training now is very important to try to reduce the risk of getting different type of cancers. Number two, after you get a diagnosis of cancer, increasing your physical activity can help tolerate the treatment, tolerate the chemotherapy, tolerate radiation, tolerate the surgeries, all these kind of treatment that take a toll on your body. So being more fit, more strong, with more cardiovascular health can help tolerate those kind of treatment better. And after you finish those treatments, we know that exercise in cancer survivors can prevent or decrease the recurrence of the cancer from coming back. So now we are learning from different cancers that increasing your physical activity at any point during your diagnosis is definitely beneficial for the cancer patient. So the way that I think of it is that we need to start putting exercise as part of the treatment. In addition to the chemotherapy, in addition to the radiation, in addition to the surgery, exercise needs to be there in order to try to fight this kind of diagnosis.
Yeah, I agree. So important. One thing I just want to mention is we first want to thank you so much to our online viewers. I know that they have to conclude since we've gone a little bit over time. My presentation before this Q&A will be uploaded to YouTube and shared in the comment section of the Q&A. Thank you for the Facebook viewers for visiting us today. I do see a question in the live audience. Go ahead.